As an internal medicine physician, I'd like to say just a brief comment on the recent diagnosis of former President Joe Biden's metastatic prostate cancer. I was so saddened to hear the news, but it raised a lot of questions in my mind. I would like to know a little bit more about his personal physician during his time in the White House. I looked him up. It looks like his name is Dr. Kevin O'Connor. And interestingly, he served during President Trump's first term and then also during President Biden's term, so there was some continuity there. I find it very difficult to believe that Dr. O'Connor didn't know that there was something going on with his prostate. You know, we do routine examinations of the prostate with blood testing called a PSA. And once that's done once, it's recommended that it's done every year. And I know that as the President of the United States, that absolutely would have been done. There are some patients that say, no, I don't want to have a PSA checked. I wouldn't treat it. I know that I could be missing prostate cancer, but I don't want to treat it. I just find that really hard to believe that that happened with the President of the United States. So if I were Dr. O'Connor, I would feel a little bit like I was being thrown under the bus, because I just know that a family practice physician who's so highly trained like Dr. O'Connor and has served in that role for so long wouldn't miss early prostate cancer via a blood test. So I don't really know. I feel like there's more to the story than what they're telling us. At the end of the day, of course, I don't have access to any medical records, but the fact that he served during President Trump's term and during President Biden's term, I have to think PSAs were being checked, and they probably knew a lot sooner than what they're leading.